Want to know how much open heart surgery costs in the United States?
So about a month ago, I underwent a procedure called the Ross procedure to fix a congenital aortic heart valve defect, and this is how much the procedure costs based on what my insurance was charged by the hospital. Right there. Oh, but wait, there's more, because that was only one of the claims. There were actually 18 total claims. Here's another one for $11,580. Another for $9,145 for all this stuff up here. In fact, here's a list of everything that my insurance was billed for. The total cost coming out to $323,582.26, and my total out of pocket after insurance was $6,203.22. Healthcare in America is pretty expensive.
Healthcare is something that everybody needs, but healthcare is becoming something that's very, very expensive for Americans. So you can just imagine if that's the bill that the insurance was billed, and at the end of the day, out of pocket, in order to take up close to $7,000. So if you don't have that money, and especially for such a procedure that's very important, you can potentially die. So we're gonna be going through the healthcare cost in the USA. And before we start, don't forget to subscribe so that we can grow the channel. And as always, let's get on with it.
Here's how much it costs to have a baby in America.
More specifically in Nashville, Tennessee.
So we're gonna start with the ultrasound that we had to get a couple days before Aspen. So that ultrasound cost us $2,067.85.
Just to make sure the baby was okay.
And now onto my actual hospital stay. So we stayed for just under 3 days.
So whatever the observation room is, we got charged $413.65. No clue what that is.
My guess is maybe triage. You know, they were observing me.
The recovery room cost us $2,702.45. A hospital stay, I don't know how that's different, but that one cost us $4,438. The emergency room cost us $1,932.90. And I don't know what the laboratory is either, but that cost us an additional $1,439.20.
The only thing I could think of with the laboratory is like maybe like my IV that I had. I don't know. But then we go into labor and delivery. So this one is the one where I would expect it to be the most expensive because that's clearly why we're there. We got charged $10,593.40 with that one. And then our anesthesia. So my epidural cost us more than anything else. That one was $14,446.15.
Was it worth it?
Yes. Yes. We also had a pharmacy and supply cost. So pharmacy cost $2,007.25. For supplies, $565.03. So the grand total for everything came out to $33,011.73.
But that was just for our stay. We also had to pay for Aspen, our newborn daughter, to be in the hospital.
So her hospital stay, to stay with us in the room that we also paid for, was $4,008.
Our complete hospital bill cost $37,019.73.
Luckily, we have insurance, but insurance only helps so much. So how much we have to pay out of pocket to have a baby in America is $11,558.93. Was it worth it? No, I'm just kidding. I'm kidding. Yes, it was worth every penny, but she was an expensive baby.
It's a lot of money.
At this point, I feel like the hospital costs are very, 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 very expensive. There's that cost, the one of the child, just them having the child with them, the other child in the hospital, they had to pay so much. That feels like now you're just making up anything so that you can get money out of people. And even though these people have insurance, the amount of money that they're having to cough up out of pocket, it's a lot of money. It's a lot of money. Like an average person doesn't have that amount of money lying down, especially in this day of world, in terms of where things are very expensive. So the cost of medical care is very, very expensive. And definitely if you can't afford, especially if you have a very important procedure, you can die. Like you can die because there's other cost as well that you're gonna need to pay for. So if an ambulance comes and picks you up, you don't want to know how much is the cost, which you're going to see later on in this video. So the cost of everything in terms of medical care, besides all the procedure that they have to do, even the medication as a whole, they are so expensive.
What hernia surgery costs in America?
Surgery 1 month ago today, and we just got the hospital bill in the mail. Let's just start with anesthesia. $6,400.
For just anesthesia? To help the pain go away. I'll just take the pain. You know what? I'll stay awake.
Laboratory.
$261.
Next is medical / surgical supplies and devices. So I guess like maybe a scalpel and the actual mesh they put in me.
What?
$13,777.02.
For the devices?
I bet you could get that cheaper on Amazon. This one's the real kicker. Operating room services.
$56,652.
These surgeons are making bad. Pharmacy. $2,000. Finally, the recovery room. $6,000.
The recovery room. You sit in the recovery room for maybe, 7 hours, and they bring you some chicken broth.
All of this for a grand total of $85,768.92.
How much do you think it costs in America to call an ambulance?
£200.
$400, $500.
$1,000.
So you're roughly there, 1.2 thousand. How much do you think it costs in America to have a hip replacement?
10 grand.
200,000.
$4,000?
Times that by 10.
Shut up.
Yeah.
$40,000?
Yeah. How much does it cost to have skin-to-skin contact with your baby after giving birth?
£100. $500?
Who knows?
They charge $40 extra. How much does it cost to stay overnight at the hospital?
$6,000.
That's got to be a couple of $1,000 bucks, isn't it?
Thousands, 2,000?
Pretty spot on there, between $1,000 to $5,000.
I don't think an ambulance and staying in the hospital should cost so much. I mean, already you're gonna charge me so much with the procedures that needs to be done, and also the medication. And even if we're talking about an ambulance and we're talking about petrol and the personnel which are helping me, but from 1,000 to 2,000, like what if the trip is so short, like maybe 10 miles? Like those are things that don't make sense in order to cut down the expenses in terms of medical cost. I think that's where things need to start.
How much does it cost to visit the doctor in America?
Probably a couple of $100.
$200, you're about right there. How does that make you feel as a Brit who gets free healthcare?
Well, I think we're very lucky to get free healthcare, and I feel bad for all the Americans, really. Yeah.
As usual, I'm really, really glad we got the NHS.
Yeah.
It's not broken, but boy, could it do with some fixing in the UK. And like I say, I'm glad as hell I don't have to pay those crazy money out in the States. It is outrageous.
Do you reckon you have got your money's worth, let's say, from the NHS?
If you'd have asked me 18 months ago, I'd have said no, but then I had a life-threatening illness, and now I can say yes.
So you're grateful?
Oh, very, very grateful, yeah. Hadn't been for them, I wouldn't be here, simple as that.
This is cray. So look at the examples here of the price difference for life-saving medicine. So epilepsy, $24 compared to $1,000. Look at the one for heart disease and high cholesterol, $2,628 and $21 in Australia. That's because the Australian government, under our PBS, Pharmaceutical Benefit Scheme, subsidises the costs of medicine, because we believe that no matter how much you earn, you should be able to get these medications. Depression, $2,244 compared to $31. If you don't have this kind of money in America, you go without, you either go into debt or you can even die. Like this is what's at stake when we think about the Australian election coming up, and we've got an opposition leader that wants like a Trump-like style in Australia. And also
So last month, as you guys know, I had a really bad anaphylactic reaction. And I just wanted to kind of showcase how amazing our American healthcare system is here and how healthcare is so affordable. I'm being sarcastic, by the way, because I think it's important to know that this is unacceptable. My ambulance bill was $2,962.98. Yeah, that's crazy, but it gets worse. So I had to go to the emergency room, and I was there for probably about an hour and a half. I didn't get a room because the ER was super busy. So I was put in a hallway on a bed with my IV, but not in a room, in a hallway, okay? On the bill, it says emergency room, which no, it was a hallway, but whatever. I got charged $5,106.17. But just to add one more thing to, the cherry on top, I had to get IV fluid for an hour and a half. Just IV fluid, nothing fancy. You know how much that costs to get IV fluid for an hour and a half? $2,990.79. I have insurance, so I'm very lucky.
I wonder if there's anyone who actually regulates these prices, because it seems like they just put any amount of price on anything, even things that don't make sense. Because definitely these medical costs, they're not making sense at all. Because when you look at it, maybe you need to discuss with the hospital so that they can just provide clarity, just to try to understand in terms of what are you paying for. I think there needs to be someone who visits hospitals, whether it's private or public, just to get a sense in terms of what people are actually paying for. Because yeah, that's absurd, man. That's absurd. So yeah, man, yeah, the medical cost out of control. That's also something that needs to be regulated. So yeah, that's all that I have in store for you, and as always, I'll see you same time, same place on the next one.